Hey everyone, welcome back to the Mass Retirees Weekly Update. Today's Friday, May 23rd. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. Now, a couple of quick reminders, save the date if you will. Today at 1 p.m., we will be holding a Tele-Town Hall Meeting. All Mass Retirees meetings are open to all association members. Today's Tele-Town Hall Meeting will focus specifically on the investment of your public pension funds. We are thrilled that the Executive Director and Chief Investment Officer of the state's Pension Reserves Investment Management Board, better known as the PRIM Board, Michael Trotsky, will be our guest speaker today. Michael will be updating our members on the investment performance of the PRIT fund for 2024, how things are going so far this year, how PRIT is specifically designed to weather the ups and downs of the financial markets. This will be Michael's third time addressing our members through a Tele-Town Hall meeting. The previous events were extremely well attended by our members, so we are very much looking forward to this afternoon's conversation with Michael. Michael will also be spending a few moments at the end of his presentation taking questions directly from our membership, which is a great opportunity for those of you who have specific questions about the investments of your pension monies. They have the opportunity to hear from Michael or speak directly with Michael. Following Michael's presentation, we will be then opening it up to questions from all of you regarding anything that's on your mind about your public retirement, about Social Security, about health care. The full meeting was going to run roughly an hour. Depending on the number of questions we have coming in, we can go a little bit over an hour, but we'd like to try to keep it to about an hour. Now, as a reminder, there are two ways that you can join and participate in today's Tele-Town Hall meeting. The easiest way is to simply receive the automated phone call, which will come in to your telephone number, whether it's your cell phone or your home number, as long as we have it on file. You will get an automated call from me at 1 o'clock. All you need to do is answer the phone, stay on the line, you'll be automatically connected to the meeting. Now, if for some reason you don't receive the automated phone call, or if you miss it for some reason or get disconnected from the meeting, the toll-free number to directly call into our Tele-Town Hall meetings is printed on the back of your Mass Retirees membership card. All you need to do is dial that number at the time of the meeting at 1 o'clock, and you'll be automatically connected to the meeting. But again, we are very much looking forward to today's event, and we're hoping to have a robust, engaged audience as we have in the past that can hear directly from Michael. Now, 2 weeks from today, in 2 weeks, on Wednesday, not Friday, but Wednesday, June 4th, we will be holding our annual Cape Cod area meeting. It once again will take place at the traditional location in Hyannis. All of our area meetings kick off at 11 a.m. Despite the fact that we have a different day of the week, Wednesday, other than our normal Fridays, the meeting will still begin at 11 a.m. So if you're on the Cape or you're nearby the Cape, or you feel like taking a ride down to the Cape, on Wednesday, June 4th, come on by, say hello. The information on our meeting location will be contained in today's email message that goes out to all association members at 6 a.m. every Friday morning as our weekly message. It contains this video, but in addition to the video is more detailed information on the topics that I'm speaking about. So as we mentioned in last week's weekly update, the Group Insurance Commission last Thursday at their monthly meeting released the 2024 out-of-pocket cost report. Now, out-of-pocket costs are your copayment and your deductible. So these are costs that are in addition to the monthly premium that you pay for your health insurance plan. And the out-of-pocket costs under the GIC, thankfully, as we've been reporting, have been consistent and stable for the past 7 years. FY26 will mark the 7th consecutive fiscal year where we have seen no increases in either the copayments or the deductible that are applied to your plans. And this is very good news for retirees, particularly during a time when virtually everything else in our lives has become more expensive. the one thing that has remained consistent is the out-of-pocket costs. And I give great thanks to GIC Executive Director Matt Vino and his team and the 17-member GIC Commission, as well as former Governor Baker and now Governor Healy and her administration for really holding the line on out-of-pocket costs. And as we've talked about previously, there is a growing book of evidence that the higher you make out-of-pocket costs, whether it's the deductible that you pay when you go for a doctor's appointment or when you pick up a prescription drug, or that annual deductible that non-Medicare retirees pay, which under the GIC plans has been at $500 per person or $1,000 per family for the better part of the last 15 years, and it has remained at that level. But there's a growing consensus that the higher you make out-of-pocket costs, the one thing it does is it greatly deters people from accessing their care. Which is not necessarily a good thing. Most of us, if we go to the doctor or if we're taking a prescription drug, it's usually for a pretty good reason. We're sick, we're hurt, we need it. And if you make medical care more expensive, and we believe, as we've been saying now for many months, that we are in the midst of a healthcare affordability crisis here in Massachusetts, if not across the entire country, that people are choosing not to access their care. And this leads to worse medical outcomes, worse quality of life, and far higher medical costs over the long run than if you just kept medical care affordable for everybody. So again, great thanks to the GIC for holding the line on increasing out-of-pocket costs. So the 2024 report, and we always look back more than a year or a year previous in terms of fiscal years. FY25 will end on June 30th. FY26, of course, starts on July 1st. A year from now, we'll be looking at FY25's numbers. But in terms of FY24, overall, it was good news for retirees and employees. And despite escalating healthcare costs, the GI's commitment to affordability for its members continues to deliver tangible results. In FY24, out-of-pocket costs, which are referred to as OOP, so if you're reading either our newsletter or today's email blast, you may see OOP mentioned. It simply means out-of-pocket costs. Those costs have remained stable and even decreased in some areas, despite cost increases overall in terms of on the premium side of things that have been driven by medical inflation and the sharply rising pharmaceutical costs. And we have been talking about these issues now for many months. And as we've been saying, we're going to continue to talk about it because, again, we believe that we have reached sort of the peak of affordability, if not surpassed it, in many cases, that more and more retirees and employees are finding it very difficult to afford to access their medical care, despite the fact that you have access to really the best health insurance plans anywhere. And certainly the best medical care in the whole world can be found right here in Massachusetts in many cases. But if our residents of this state, the citizens of this state, our members can't afford to access that care, it really doesn't do anyone any good. So that's why it's very important that these trends, these costs are compared year over year, that all of us are keeping very close tabs on it, and we appreciate the lengths that the GIC continues to go to showcase and provide transparency in terms of these numbers. So in terms of where the rubber meets the road, non-Medicare, or let's start with the Medicare plan since that's where the majority of our members receive their health insurance coverage if you're over the age of 65. I realize not all of our over 65 retirees are Medicare eligible. This continues to be a topic of specific focus by our association and by the GIC. As a matter of fact, Matt Vino and I had a conversation about the Medicare buy-in program again this week. So it is very much something that's top of mind, both for us and the GIC, and we're very hopeful that steps will soon begin to move forward with a buy-in program for non-Medicare eligible GIC enrollees, which we believe that there's a little bit over 10,000 retirees insured by the state that would fall under this level. But in terms of the Medicare plans and the out-of-pocket costs, the good news is that things have remained very stable across the board. We haven't seen any real wild swings one way or the other. The price per member per month, and this is how things are really measured when it comes to out-of-pocket costs. It's how much it's costing retirees or members, enrollees on a per month basis. And those costs have remained relatively stagnant. Now, the good news also for Medicare enrollees under the GIC is that there is no deductible. So that $500 annual deductible that I mentioned a moment ago, that is only paid by the non-Medicare plans. And that's why it's so important to us to find a way to enroll our non-Medicare eligible retirees in the Medicare plans. Because right off the top, you're going to save $500 per person per year by being in a Medicare plan versus the non-Medicare plan. So that's a pretty substantial amount of money, particularly for people living on a fixed income. On the non-Medicare plans side, we've actually seen out-of-pocket costs per month decrease very, very slightly. And again, this is despite the fact that we have seen overall medical costs significantly going up, and the premiums that are charged or that you pay every month reflect this, where under the GIC, the average premium increase per month for the non-Medicare plans was over 10% for FY26. Thankfully, on the Medicare side, it is slightly less than that. We're still in the single digits, even though it was a larger than normal increase. But on the non-Medicare side, the overall, despite the fact that costs are going up, and when it comes to prescription drugs, we know that costs have gone up in the aggregate for prescription drugs, but the out-of-pocket costs have actually dropped by more than $1 per month, about $1.20 per month per member. Now you might say, well, $1.20 a month is nothing, but when you multiply that across the hundreds of thousands of enrollees under the GIC, that adds up very quickly across everybody. And would like to see the trend decrease as this has indicated, rather than going up. The reason why the price per member per month has dropped is largely due to the fact that CVS Caremark, through their contracting, have been able to deliver lower cost generic drug pricing. So if you are taking some type of a generic medication, a maintenance drug perhaps, those costs have significantly been reduced over the past couple of years. And again, despite the fact that overall prescription drug prices have significantly increased, the copayment amount being paid has been reduced because of the generic drug pricing advantages under the GIC. Now, we still have significant affordability concerns. Across the board, medical spending is up. And as we have been explaining, the driving forces behind medical spending are the prices charged by doctors and hospitals. And those prices tend to lag behind because contracts exist between the GIC, or between the health plans and individual hospital systems, doctor groups. And those contracts, when they come up for renewal, if inflation, as we've seen in recent years, has been high, those entities naturally want to increase their prices. So that's happening at the exact same time that we're seeing significant increases in terms of prescription drug costs. And as we explained last week, and the Boston Globe, as a matter of fact, just this Wednesday, editorialized on it, and we will, the weekly email message to all of you will contain a link to the Globe's editorial. The Globe is paywall protected, so if you don't have a subscription to the Boston Globe, you might not be able to access it, but we will provide the link anyway for those of you who are Globe subscribers. But the Globe editorialized specifically on the issue of GLP-1s in relation to the GIC. And it's very much in line with what we have been talking about, what Blue Cross and Blue Shield has been talking about, and Point 32, which is the parent company of Harvard Pilgrim and Tufts. that the significant cost of GLP-1 weight loss medications are really driving, to a large degree, the cost increases when it comes to prescription drugs overall. And tough choices are really, unfortunately, on the horizon when it comes to paying for or allowing access to certain types of medications, largely due to the cost. Now, let's end this segment with some good news in terms of the Group Insurance Commission and how it compares to some of the private sector or other plans here in Massachusetts. Now, the total non-Medicare medical spend across the GIC, so this is the percentage of the total healthcare costs, again, for non-Medicare plans, that is paid for by the GIC is 91.6% of that total cost is covered by the Commonwealth under the GIC. The private sector average for what's known as jumbo groups here in Massachusetts. So these are large employer plans, more than 500 employees. That average medical spend is only 89%. Well, still the lion's share of the cost is being paid by the employer. The Commonwealth under the GIC is paying a larger share of those medical costs than their peer audience. We also know that over the last couple of years, particularly in 2024, 31% of large employers engaged in some type of cost shifting onto their employees or retirees. This is either through higher deductibles or higher co-payments in terms of the out-of-pocket costs being paid. The GIC and most municipal insurance plans across Massachusetts have not engaged in cost shifting really over the better part of the last decade. We have not seen that really take place, at least not in terms of a large scale. Now, we are very concerned about this going forward as these costs continue to go up and up and up, and local and the state budget continues to tighten. These are concerns that we have, because the last thing we want to see happen is simply cost shifting, making you pay more for an inferior product while the government and local, either the state or local governments, pay less. That does not resolve the problem going forward. So that's why we are going to continue to focus so much on these issues. We're going to keep talking about these issues, and collectively, we've got to find a solution to gaining control over medical costs and runaway inflation when it comes to healthcare in general. So the last thing I want to say before we wrap up for this week is just simply thank you. Thank you to those of you who have very generously donated to our Political Action Committee in 2025. We launched our annual PAC drive at the end of March. As of now, more than 10,000 of our members have chosen to voluntarily participate by making a small contribution. In some cases, large contributions. I can't tell you the number of larger contributions we have seen come in this year, with thank you notes largely related to the implementation of the Social Security Fairness Act. We very much appreciate your support, your kind words, your dedication to standing with us as we represent all of you. Our Political Action Committee, as we have said, plays a critical role in the work that we do on a day-to-day basis on your behalf. And it really gives us the tools that we need to properly defend your benefits and advocate for improving those benefits going forward. And at a time, again, when state and local and federal budgets are tightening, programs are being cut, having a robust PAC that we can utilize on your behalf really makes all the difference in the world. So again, thank you if you have taken the time to generously contribute. If you have not contributed yet, please consider doing so. The link to make an online contribution will be contained in today's email message. You can also find it on our website at massretirees.com. But we very much appreciate you being a member of our association, as well as your continued dedication to the work that we do on your behalf. I'd like to close this week's message in remembrance of our heroes. May you and your family have a beautiful Memorial Day weekend, and we'll be back to you very soon. Take care, everybody. Bye-bye.